poverty, ensure access to decent job, housing, food, education, particularly healthcare, and again, as I said, all of these are interrelated, among the urban poor, including slum dwellers. Ensure sustained supply of essential services. Thank you very much for your attention.
Thank you, Professor Bhargavi. I'm sure it is a very interesting presentation, but of course we have a limitation of time, but we have learned a lot. And there is no doubt a healthy citizen plays a major role in the development of the country. So for the development of the country and the health, I have very strong indicators that this will happen. Ladies and gentlemen, now we are coming to our to have some words from our guest of honor and chief guest. May I request Dr. Tushara Diaz Indranath Fernando, Director of ICA, the Deputy Secretary, Bangladesh. Dr. Tushara.
Thank you very much. Good morning. Honorable Chair, Dr. Buskari, Honorable Chair, Professor Zakam, special guest, Professor Buskari, my fellow speakers, distinguished ladies and gentlemen. I thank you for this opportunity provided to me to be part of this global conference on community health, which is an extremely important and timely topic for discussion. It is very much at the center of discussion in WHO and also personally very close to my heart. In an era when we talk about strengthening the health system through revitalizing the primary health care, and at a time when countries pledge their maximum support for universal health coverage, the theme of this conference is very much mature. If you look at the broader picture, the Southeast Asian countries are unique and I would say more or less homogeneous in terms of certain challenges that we face. We, the Southeast Asian regional countries, are the home for about 25% of the population of the world. At the same time, we share a proportionately much larger part of the global disease burden. Many of the countries of the region have similar health system challenges. For example, weak health information systems and health workforce issues and inadequate health financing, etc. But at the same time, from our region, we see certain good practices coming up from certain countries. If you look at more critically, one can argue that compared to many other developed nations, that the South Asian countries, the systems of the South Asian countries are frail, fragmented, and disorganized. But however, we as South Asians can be proud that we have a rich, strong, multidimensional, multifaceted social system which we have inherited from generations. When compared to many other countries, our social systems are established with strongly bound community systems knitted and weaved to the social fabric that are extremely resilient to many problems that we face. If you look at some countries from this region that have achieved extraordinary health indicators, for example, Thailand or Sri Lanka, it is not a secret that our health systems are built around strong community health systems. I am delighted to note that Bangladesh too is investing tremendously on community health initiatives over the past several years. This emphasizes the emphasis paid by the government on community health clinics is an excellent example. I have visited several community health clinics over the past 6 months and spoken to many people who have come to those clinics to seek treatment. I I have introduced disconnecting healthcare service providers, and not stopping there, I have even interviewed some of the medical community, the doctors, the medical community, nursing community from the social hospitals and district hospitals during my field visit. And the perception that they bear about these community clinics, the community health services, is amazing and truly encouraging. All of these people whom I have spoken to, they believe that community health centers play a key role in enhancing the health of the people in their locality. And they believe in it. And I do believe that until such time, all people, especially the poorest of the poor, the marginalized, the disadvantaged, they have free access to qualified healthcare providers such as doctors and nurses, etc. When I talk about access, I mean not only physical access, financial access, social access. Until such time, I also believe that the community clinic can play a critical role in Bangladesh. We have scope to further enhance these community health clinics and centers. On one hand, these community health clinics can be further strengthened by ensuring that the service providers are subjected to regular in-service training, and also providing them with certain tools like simplified algorithms, technical algorithms for them to follow whenever they manage their patients. On another hand, I would view that a formal referral system, it could be established between this level and the next level of the healthcare hierarchy, could certainly further enhance the functioning and utilization of these community health clinics. And also, that will improve the confidence of people to utilize these services. And thirdly, these community health clinics can be utilized to further broaden the community health services and activities in their respective communities, and can be the hub for the village community for community health programs. Since the past 8 months, I have seen that in Bangladesh, I have witnessed the Ministry of Health and the department paying a lot of emphasis on that, and also have witnessed the commitment of the government to further strengthen these community health services. I congratulate the government for that. I believe that this conference will provide us an excellent pedestal to share our experiences, to learn from each other, which will show us how we can further fine-tune the country's community health initiatives. I thank the organizers of this conference, and I wish the conference success. Thank you.
Thank you, Dr. Bishara. Yes, there is no doubt that the community plays a very important role in improving the public health intervention, particularly not only the community health providers, but also the community people who should play a very important role. And Bangladesh is one of the roles in these primary health care sectors. May I request the country coordinator of the UNAIDS Bangladesh, Mr. Leo Canning, for his address.
Assalamu alaikum. I wanted to first just reflect the UN Secretary General's condolences that he sent to Bangladesh on the demise of your president. Condolences with you. Chairs and fellow speakers, first of all, thank you very much to Babu Medical University, an eminent and partners for health, for convening this really important meeting. I'm delighted to be here. I think the theme of community health and the issues that we're going to discuss here firmly reflect UNAIDS' mandate as we talk about underserved population and as we work with the needs of the most marginalized and socially excluded sections of the community. And that's why community health is absolutely critical to the HIV/AIDS response in this country and globally. But I would take a bit of a global perspective. I think that building effective community health will remain dependent upon the global health agenda. And never has this been more important than here now in Bangladesh. As Bangladesh takes a seat at the table globally in trying to shape the agenda for global health in the post-2015 MDGs. Last week, Bangladesh hosted a major meeting with 52 member states on population dynamics in the post-2015 development agenda. I raised a number of issues there that I would like to raise again here as we discuss how to build effective community health interventions.